I'm going to demonstrate the preferred method to mix and administer 0.01 milligram per ml epinephrine, commonly known as push-dose epi. Push-dose epi is used for persistent shock and hypotension unrelieved by proper volume resuscitation. Since epi does not come pre-mixed in a 0.01 milligram per ml solution, you will need to mix your own. You will need the following supplies: epi, 0.1 milligram per ml. You may know this by its previous labeling of 1 to 10,000. A saline flush, a 10 cc syringe, a 1 cc syringe, tape and a marker to make a label as I have done here, and a syringe to syringe adapter. Reviewing my patient rights. This is for my patient. The medication I need is epi, so this is correct. The dose I need is 0.1 milligram or 1 ml of this solution. I need to dilute it before I administer it via IV. I'm giving it for hypotension. As I de-dice my medication, the drug is epi. The dose is 0.1 milligram or 1 ml to be diluted. The integrity of the container is intact. Color and clarity is good. There are no floaty things and it's nice and clear. Concentration is 0.1 milligram per ml. And it's not expired. Start by assembling the preload. Attach the syringe to syringe adapter. And evacuate the air. Attach a 10 cc syringe. And you're going to draw up 0.1 milligram or 1 ml of the epi, 0.1 milligram per ml. Detach your preload and attach your saline flush. You're going to push in an additional 9 mLs of fluid to bring this up to a total of 10 mLs. You now have 10 mLs of epi, 0.01 milligram per ml, which is your push dose. You're going to shake that to blend it a little bit, and then make sure you put a label on it. You certainly wouldn't want somebody to confuse this with saline and give it by mistake, so you definitely want to label it. For adults, administer 1 ml or 0.01 milligram IV every 1 to 5 minutes, titrated to maintain a systolic blood pressure of greater than 90. For pediatrics, administer 0.1 ml per kilogram or 0.001 milligram per kilogram IV every 1 to 5 minutes, titrated to maintain a systolic blood pressure of greater than 70. Remember, the pediatric dose should not exceed the adult dose. Since we know the best way to prevent medication errors is to only draw up what I intend to administer, I'm going to draw my dose, which in this case is 0.1 milligram or 1 ml, the adult dose, into a 1 ml syringe. This is what I would administer to my patient via IV route. What if, due to an epinephrine shortage, you are only carrying 1 milligram per ml epi? You'll know it better by its old labeling of 1 to 1,000. Then you would, of course, need to dilute this. And what if you don't have the syringe to syringe adapter? Well, then you can use a 3-way stopcock in the same manner. So first you're going to take your 10 cc syringe, Draw up your 1 ml of epinephrine. Attach your 3-way stopcock. Attach your normal saline. And make sure you shut off the other port so that fluid doesn't go out to that side. And you're going to push your 9 mLs of normal saline to make this a total of 10 mLs. We're going to label this as 0.1 milligram per ml epi. You might note better as your preloaded dose. And you're going to substitute this into the same mixture as you would where the preload was. So now you dilute this 1 ml of this in 9 cc's of normal saline.